We're all so busy living our lives. And then suddenly something cuts through that, something often very unexpected.
Paediatric trauma call, 15 minutes.
A 71-year-old female with 2 stab wounds to the back.
He was found to be in traumatic cardiac arrest.
St Georges. I can't feel any pulses. We're at St Georges Hospital in Tooting.
Yeah, 24 hours, 7 days a week. I love that question. What's your opening hours?
St George's, London. One of Britain's busiest A&E departments, under more pressure than ever.
So do you want to watch, darling, or do you want to look away?
This is the worst day ever. You never know what's coming in, and you just have to be ready for anything.
Gas canisters exploded, 15% burns to hands, face.
In a world of uncertainty, we see a life-changing event.
I'm at A&E, I need her to get out of here, please.
When patients come in, something takes over.
I'll be fine. I'm going to be very fine.
A place where life,
Give me an A. Give me an E.
love,
Okay, good lad. Well done.
and loss unfold every single day.
Did you enjoy the Queen's birthday yesterday?
I watched the football.
All the patients you're about to see were treated in just one 24-hour period.
Don't worry.
We get to see people who love one another in loads of different ways. Yes. And I think you can give someone the best care in the world, but really what they want is to hold the hand of the person that they love and for them to tell them that they're going to be okay.
You're my hero.
Janet. Hi, I'm Helen. I'm one of the nurses. Oh. And how did you do this then?
Scrambled egg exploded from the microwave.
Did you have eggs for a while?
I know.
I always forget you can do scrambled eggs in the microwave.
I know.
Okay, so we'll brace on this side, and then see if you can pull out, seeing as you're all on this side.
Starting his shift in resus today is registrar JD.
He works in the gym, and he slipped on the wet and landed backwards. Decide what you want, if you want CTs or just plain images. I spent a bit of time in A&E as a kid just with usual scrapes, broken bones here and there, but nothing too dramatic. When I was a kid, I had a problem with my toe that needed an operation that I had to spend about, it must have been 6 weeks or more in a plaster cast, and I think I was maybe about 3 or 4 years old, and my mum had to push me around in a pram, and I think by that point I was a little bit too big for a pram, so that was fairly embarrassing. Okay, you guys can all stand down. Thank you for staying to help with that. When I was younger, I wasn't sure whether I wanted to be a fighter pilot or a doctor, and I think after speaking to my dad, I decided to be a doctor. He said that if I did grow up and I was a fighter pilot, then there might be one day that I have to hurt somebody in the end, but if I was a doctor, then I would only ever have to help people, and so I guess I decided to be a doctor for that reason. So she's stable, but we're just doing the test to try and find out what the problem is. The way that I think about A&E is it's a lot like a duck on water. Above the water, the duck's fairly serene, but below the water, it's paddling away pretty frantically. There's not a lot of use in flapping because it doesn't really help anything, but you can still be shocked. We really should do some blood tests, and it also means we can give you some painkillers. Well, it'll involve a little needle. You'll be all right.
Hello, St George's. Medical trauma. Yep. Yep. Cheers. Thanks, bye.
A 79-year-old man is being rushed to A&E after collapsing in the street whilst walking his dog.
Priority call, 10 minutes.
What's the next one that's coming in?
O'Meara would collapse and with loss of consciousness.
Anything that lowers their blood pressure, the heart's not beating properly to get the blood to their brain, then that would cause somebody to collapse.
Are you taking this one?
I can, do you want me to?
They could fall and they can break bones, they can break their hip, they can break the arm. You worry about the injury to the brain and injury to the skull. Then you worry about a bleed on the brain. As an older person, you're more at risk of those injuries being life-threatening.
The man's daughter is travelling with him to St Georges.
It was the May half term. I knew my dad was on his own that week because my mum had gone to Bournemouth with my sister. It was my intention to call in on him. We set off and I saw on the other side of the road there was a man lying on the floor. It didn't look very good because he was lying in a pool of blood. And then I recognised the dog and I recognised his jacket. So it was like a slow motion that I realised that it was my dad. And I just said to the girls, don't look around, just wait in the car. And I rushed over there and there was about 3 or 4 people standing around him. He was just making this awful sound that didn't sound like him at all. And I just put his head in my lap and I was just talking to him, Dad, are you all right? Just stay awake, Dad. Somebody's got the dog's fine. Somebody be here with you soon. But I thought if he does go, hopefully he'd have heard my voice.
Take a seat in there for the moment, darling, and we'll see what can I get you in a sec, all right?
It was such a shock to see him like that.
Yeah, I'll put that on. Okay. This is 79-year-old Mike. Was found face down in the street. He said he was out walking the dog, felt a bit groggy. That's the last thing he remembers.
And do we know how long?
No, he still has no recollection of the actual collapse. The 12-lead ECG is showing, as you can see, AF. It's very, very regular. He's very tachycardic, bouncing around about 142.
The normal heart rate is from 60 to 100, so 142 is significantly elevated. The heart could go into a rhythm that would cause cardiac arrest, at which point the heart could potentially stop beating altogether.
Medical registrar Rebecca has been called to resus to assess Mike's condition.
The emergency department doctors have told me that you were basically found unconscious in the street earlier. What do you remember?
Well, basically, I crossed over at the lights, pedestrian lights. And when I got over there, I felt a bit groggy.
When you say you felt a bit groggy,
head felt a bit swimming a bit.
what's the next thing you remember?
Waking up on the stretcher.
Mike needs urgent medication to bring his heart rate under control, whilst doctors assess whether a problem with his heart or brain has caused his collapse.
We worry about people having these episodes of blackouts, okay? This happened relatively suddenly. You've hit your face. You were probably unconscious before you hit the ground. We need to make sure that there's no evidence that you've had a stroke or that there's no bleeding on the brain or something like that that may have precipitated this collapse.
My dad has always been there for me. I've never had to think about how much he means to me. It's just somebody that's always been there that I can rely on. And I think until you lose someone, you don't realise how much they mean to you.
Retired civil servant Mike has been rushed to A&E with an abnormally high heart rate. He collapsed in the street whilst he was out walking his dog Louis.
We got an ECG. Just try and get the ECG first.
Doctors have given him medication to bring down his pulse and are carrying out tests to determine if he suffered a heart attack or a stroke.
Dealing with the uncertainty is one of the things that we do in the emergency department. You want to try and make sure that they're not going to collapse again and not recover. You just have to do your best detective work.
Mike's daughter Emma travelled to St Georges in the ambulance.
Oh. Do you know anything about what happened?
His son Neil has just arrived.
He's taken the dog for a walk, started to feel groggy, and that's the last he remembers. He was lying in quite a lot of blood.
Mike's wife Rita has been informed of his collapse and is travelling to St George's from over 100 miles away in Dorset.
We worked together for a while in the 60s. We were working at standing power tools. Very smart, always had a nice clean white shirt and tie for work. They used to have like a band practice at this firm we worked with. He used to play lead guitar. He was very good. Used to be called the Moonrakers. We got married at St Paul's Church, Clapham, in '65. Wasn't a big wedding because we couldn't afford a big wedding, but it was mainly family and friends, really, which was nice. I had the 3 children, the 2 girls and a little boy. He was absolutely over the moon, absolutely over the moon.
Just got your family coming in now, okay?
He's my companion, your right-hand man, isn't it, really? Been so lucky, really, to have it, to have him.
You all right, Dad?
Yeah. I couldn't believe it to start with when I came round. I thought, I'm dreaming this. What's happened?
Louis must have stayed with you because he could have easily run off and he didn't.
Bless him. I was only out because of him. I don't know what would have been happening if I'd collapsed in the house.
No, I know, that's what I was thinking. Could have been a lot worse.
When I left school, I worked in London, and I left school at 16. And my dad used to come with me for interviews, so he always used to chaperone. He always used to be really good with helping me with CVs, letter writing. He was brilliant with all that. When I eventually got a job, I used to meet my dad for lunch. It was just like that comfort of knowing that I've got somebody in a big city. He normally used to, you know, give me a shoulder to cry on, and he's just always been there for me. It's been really good having such a wonderful dad.
Doctors have received the results of Mike's heart trace. It shows that the medication given to slow down his heart rate hasn't been effective.
Your heart rate's actually going quite high in an abnormal heart rhythm now. So the first things first, a CT scan, try and piece out what we think exactly happened yesterday. How long do you think before you started to feel unwell and hitting the deck?
That must have been pretty quick.
Yeah? So maybe a minute of feeling a bit woozy and a bit off.
Yeah.
And then
Nothing.
Nothing.
Doctors are concerned that Mike's high heart rate may have caused a blood clot in his brain and are sending him for an urgent CT scan.
Hello, A&E, can I help?
Harry, would you rather have toes as your fingers or fingers as your toes? So you'd have 20 fingers or you'd have 20 toes?
Fingers as toes.
Because
then you can climb like a monkey.
That's true, that'd be so cool.
I know it hurts.
Oh dear. You didn't think this was going to happen when you woke up this morning, did you?
Well, no, it just fuckens up business, doesn't it?
53-year-old chartered surveyor Andrew has been brought to resus with a suspected dislocated shoulder after tripping over a paving slab on his way to work.
Thanks for being here.
His daughter Hannah travelled with him in the ambulance.
He mountain bikes, he sails, he speedboats, he does all this crazy stuff, and we ended up in A&E with him because he tripped on a paving slab. He's He's always been a bit more adventurous. I think it's the speed.
Whoa. In the construction industry, we have a phrase, JFDI, you just flipping well get on with it. There are many things in life that you can complain about, but it is what it is, and just get on with it. And I think that is a certain philosophy that I hold true to my heart.
I'm not.
I am just enjoying it, frankly.
Yeah, but it's a build-up.
Oh, I've got to concentrate on something else. Dirty British coaster with a salt cake smokestack butting up the channel between the Mar gales.
Is this the Enternox doing this?
He's trying to distract himself.
Oh.
Oh, to be down by the sea again, to the lonely sea and the sky. But what I ask is tall ships with a star to guide me by. As a rule, I don't swear, don't particularly care for the words. I do. I do the odd sausages now and again, and I do the odd flip. But poetry is a bit of a love of mine. We have no time to stand and stare. No time to stand beneath the boughs and stare like sheep and cows. It's populist poetry, like Alfred Lord Tennyson and John Masefield and William Henry Davis. The lighter poems which I relate to in everyday life. Oh, show some backbone, man.
Right, my name's David, John David. I'm one of the doctors here. You've landed on your left shoulder.
Yeah.
Can you feel me touching you there?
No.
You can't feel that?
Quite numb.
Is it?
Yeah.
In there?
Yeah.
OK, well, we'll just have to get some x-rays. It might be that you've broken and not dislocated it. But it's slightly worrying if you're a bit numb here and you're struggling to move your pinky there as well. So we just have to check to make sure you've not done any nerve damage to it. We're just going to get the morphine for you now, and then we'll try and get you feeling a bit better.
My dad is very caring, and he offered me a job at his company. My dad runs a chartered surveying firm, and we design restaurants. I did make my first mistake on my first day, and I got really nervous. Because also, I think if you make a mistake when your dad's your boss, it's not just that you've made a mistake, and you got to, tell your boss. It's you got to tell your dad, who's your boss. Luckily, it wasn't a big mistake.
Andrew needs an X-ray to check whether he's also broken a bone in his shoulder.
Sometimes I go and buy his lunch for him. And in the mornings, not every morning, and don't tell my mum this, sometimes he has a bacon sandwich. Yeah. And then if he's feeling naughty, he'll have a Danish pastry, but my mum shouldn't know about that either.
"79-year-old Mike was rushed to A&E after losing consciousness and collapsing in the street. He's been sent for a CT scan to investigate whether it may have been caused by a stroke.
Hello. I'm not sure how long he's going to be in. We're still in A&E. We haven't gone anywhere yet.
Oh, okay. All right.
As soon as if we move, I'll tell you.
Okay.
Speak to you in a bit. All right. Bye-bye.
In A&E, when people are at their weakest, having your family around you and a family that cares for you, and one that's ready to drop everything and be there when you need them, is really one of the most valuable things in life. Seeing that, I find particularly reassuring and comforting.
Can you see it on the AP?
Mike was an only child. His father died, so he's only had his mum. He was very close to his mum.
Nana was always a big part of the family. She used to live in Clacton. She used to take us to the Wimpy, then we used to have a hamburger with a knife and fork on a plate. She used to tell us about when she used to be a tiller girl. She used to do the dancing. She was in her 60s and she could still kick her leg almost up to her head. And we used to be in awe of her for doing that. She was amazing. It was a good last memory, yeah.
Mike's mum was staying with her brother at the time, and she just collapsed. Michael was absolutely heartbroken when Mum died, because really that was more or less the end of his family line when Mum died. No brothers, no sisters. That was very difficult, very difficult. It's one of those things that time heals all wounds. At least he's got our family that we'd made. He'd lost one part of his family, but he'd got another one.
Mike will continue to be closely monitored until doctors receive the results of his CT scan.
The worst case scenario, and they have a bleed on the brain, is that they could die. So that can be a major life-threatening event that you need to pick up quickly and intervene as soon as possible.
Got a lot of pain, but he's actually got loss of sensation on his badge patch. I think it might be a fracture dislocation. Yeah. So I don't think we'll get that back in.
"53-year-old Andrew is in resus after tripping over a paving slab and landing on his shoulder. His wife Jane is travelling to St Georges.
Right, so Andrew, as we suspected, you've fractured it and dislocated it. I mean, you might be able to see it from here. Can you see it? So you've actually broken a little bit off here, so it's dislocated here and it's broken off a little bit there. So that makes it slightly harder for us to just put it back in for you. So actually what we want us to do is go and get a CT. So we're going to get a more dedicated scan of your shoulder to just see exactly what's happening in there.
I feel wonderfully grateful to my father for introducing me to all matters of water. I've got a 37-foot cruising yacht. Got heating, got hot and cold running water, you have a shower. You could live for months if you wanted to. Yeah, it's lovely.
Yeah, just nice and steady, please. This really, really hurts.
When you're little, it is quite scary getting into a big boat. And when you're small, you're that much closer to the water. And I had a life jacket with Snoopy on it, and it was the best life jacket ever. I love that life jacket. It was yellow, and it had Snoopy everywhere. I think he was keen for us to learn all the rope techniques, but don't ask me about them because I'm really not very good.
Push the tiller away from you. What does she do? Pulls it in, goes in the wrong direction, ends up on the bank. Sailing is it can be an extreme sport, and so when the sea is doing that and it's coming in horizontal and you're thrown up over the side and the boat's at that angle, it's completely an alien environment and a lot of people don't enjoy it. And I get horribly, horribly seasick myself. Horribly seasick. There's two stages for seasickness. There's one where you think you're going to die, and then there's the next stage where you wish you were dead. But somehow I got through that. The love of sailing overreaches the physical downside of it on occasions.
I think it's fractured as well, and it looks a bit of a mess. Pretty bad, actually.
I've always had the carpe diem attitude. You just got to get out there and do it while you can.
Andrew will be taken back to resus whilst doctors wait for the results of his CT scan.
Do you want some juice? Juice? Juice?
9-year-old Callum has been brought to A&E by his mum Kelly and sister Annie after pushing a piece of plastic toy in his ear.
Just tight. Maybe it's not going to be too long here.
Sort of in my 20s, I liked a good night out in the pubs and clubs and stuff and dancing. Met my boyfriend in a nightclub. I was 17. I was quite drunk, even though I was 17. He was my first sort of serious boyfriend, I suppose. But yeah, no, he did want children.
Ow! Watch out!
When Callum was born, it was lovely. Because you think, wow, I've actually grown this little baby inside me. Well, he wasn't little, he was quite big, but just seeing, you know, he's got all his 5 fingers and his toes and, you know, everywhere, everything's where it should be. It kicks home then that you're a mum.
Callum? Hi.
Say.
Callum, up you get, mate.
That's okay. Hello.
Hello.
Hi. Hello, Callum. Okay, do you guys want to come in?
Go in there.
Do you want to sit up on the bed?
Thank you.
So, I understand from what the GP letter told us that Callum's got a little bit of plastic somehow
That's
stuck
right.
in his left ear, is that right?
He has indeed. He's basically chewed a toy that was all in his bedroom, but I didn't see it until Sunday evening.
Is it causing him any discomfort or pain at the moment?
Not at this stage. He's not mentioned any pain or anything, so...
OK.
But I don't know if it's mentioned he's autistic,
Yeah,
so
yeah,
he
it was
doesn't
mentioned.
necessarily express kind of until it's raging.
I'd say by the age of 18 months, I knew that something wasn't right. There's one particular moment I went to a soft play with friends, and they had 2 little ones as well. And it was, you know, this great big padded play, soft play area with a massive bouncy castle. And Callum was the child that would go behind the bouncy castle to investigate the fan. Or he would be at the fire door messing around with the fire extinguisher or putting his mouth all along the glass of the fire door. And for me, that was my moment. I actually started looking on the internet, probably the worst thing to do, but researching different, you know, conditions. He ticked quite a lot of the boxes and I knew there was something wrong, but then it was just making somebody listen to what I was saying. It's not nice accepting that your child has, you know, is different, I should say, is different, and that's hard to deal with, especially as your first child. You start thinking, oh, did I do something wrong in pregnancy? Did I cause that? You know, after all, he was in my body, I grew him.
How is he with examining of the ears?
Well, unfortunately, this happened probably a couple of years ago. He had mouldable foam in his ear, which ended up being day surgery, and because he just couldn't have anything near him. But the fact I've bought the iPad this time, I'm hoping that maybe he will allow you to do it whilst he's playing. I'm hoping that you might be able to get it out.
Well, what we'll do first then is we'll have a look just to see exactly what's there and how deep it is.
Yeah.
So, Callum.
Callum, can you move that way a little bit, darling?
So I have a look at...
Callum, move this way, sweet. There you go.
Ah, brilliant. So...
With Callum, routine is a key. I have to be quite rigid myself to help him cope every day, and I think that's how we get by so nicely indoors, because he knows what's expected, he knows what's going to happen, and so for me that makes my life somehow easier.
Callum, I'm just going to have a little look with a light at your ear, OK? Yeah?
He's got no way of explaining what he feels and his emotions, and he has a few words, very few words. He would say "duk" for book, or if you asked him where does it hurt, you know, oh, it'd be my mouth, and he's pointing. So, yeah, it's tough. It is tough. I don't like to rely on people too much. I don't like to be let down by people, so hence I try to do as much as I can by myself.
I'm just going to touch your ear. Is that all right? Is he all right with it?
Yep, he'll be fine.
Okay, so I can see it quite well there. What I'm going to do is we'll get some very tiny forceps that we can use to try and grab it out now, and then we'll see if we can get it. 'Cause it seems quite calm at the moment. Is that all right? Yeah.
I think
Just give me a few seconds. We'll see if we can get it out for you.
It did put a pressure on our relationship. It's hard to say how exactly, but obviously bit by bit we drifted. We did drift apart.
Yes, darling, it's got to come out. It can't stay in there, can it? It can't stay in there.
What are we thinking? Why do you think he's had fast AF?
We don't know, so he had a collapse.
Earlier today, 79-year-old Mike was brought to A&E after collapsing whilst out walking his dog. He's experiencing a rapid pulse, which doctors are concerned may be the result of a blockage in his heart.
Hello.
Hello, Dad. What have you been up to?
You tell me. Hello, Darcy.
Mike's wife Rita, other daughter Jenny and granddaughter Darcy have arrived at St George's.
Unbelievable, isn't it? Have they said what it could have been? Why?
No,
How do you feel now? Have you got a headache or feel groggy?
It's a bit groggy, but...
I suppose it would because of a head injury as well, isn't it? And they don't know why you collapsed.
And when I came to, all I could see was a sea of red because there was blood all over my face. Apparently there's blood on the pavement.
Yeah.
Imagine if I'd been driving.
I know, exactly.
You were very lucky.
My dad took early retirement. My mum used to leave him lists of jobs to do for around the house. And my dad used to cut the grass and clean the van, and I always got the impression he quite liked it. Quite liked being at home and not having to go up London every day. He liked the quiet life, so he was happy.
Still, at least they're going to sort you out now and find out exactly what the problem is, why you had the blackout.
I think when your parents stop working and they retire, they become into this bubble. I remember thinking, no, he's not as quick as he was and he's not as agile, and if we go out in the cold for too long, you know, he might need an extra jumper on where he didn't before. Just trying to put myself in his shoes, really.
I think you were very lucky for Emma to drive by and literally see you and think, oh, my dad.
She recognised Louis as well.
It was little Louis that she saw. So she turned around and come back again. Weren't they? Just going up and down, look.
Yeah, I wonder why.
Don't know.
Why is your heart rate going up? Because you're lying there.
Doctors have received the full report of Mike's CT scan. The results show that he has not had a stroke.
Is there a plan?
He's definitely staying in tonight. The concern was he was almost all ready to go and everything set up, and then that's what happened. See? Gets a little excited and then goes up again.
If a patient has a sustained abnormal heart rhythm, then the arteries that supply the muscles of the heart are blocked. It is very important to unblock the arteries as soon as possible.
And the plan is to bring him in.
Mike will be admitted to a ward for further tests to assess whether or not he needs potentially life-changing surgery.
When you're younger, you sort of listen to everything they say, you do as you're told, whereas now I'm almost like, feel like I'm the parent. And you suddenly have to realise that we're not all going to live forever and we're all getting older.
"53-year-old Andrew was in resus after dislocating and fracturing his shoulder. His wife Jane has arrived at St George's.
Oh, Tiger. I don't know, it's just the weirdest thing. Tripped up. and I just went down completely like a felled tree.
I don't know whether to touch you or not.
No, I'm okay. Just don't get emotional on me. It's not a pretty sight seeing a grown man cry.
It's the most painful thing you can do.
Well, goodness.
Sorry, guys.
Oh, don't apologise.
Doctors have received the results of Andrew's CT scan.
OK, no problem. OK, thanks. Right, hello. How are we doing?
Yeah.
You look a little bit more better, but more comfortable than before.
Yeah, thank you.
We're getting there slowly. The orthopaedic
Yes.
doctor, and he says that he wants us to try and put it in down here.
And that's purely him just sort of giving it a good old wrench and getting it back in.
More or less, yeah. That would be the sort of blunt way of putting it. But
So,
yeah, it's slightly trickier than usual because you've fractured it as well as dislocated it.
There's a chip.
More than a chip, but I'd say a chunk.
Yeah.
All right.
Lovely.
Good.
Right, if I can get you ladies just to come round this way, get you to sit in the waiting room. He's in good hands.
So they don't hear the screaming.
My parents, they provided us with a very stable, very loving lifestyle, for which we are eternally grateful, and realise that we were very lucky to have that.
Just going to give you some stuff to make you a little bit sleepy now. So this is like the morphine you've already had, but it just acts quicker. If the morphine's like a pint of beer, this is a bit like a shot of vodka.
Mum, she had cancer. And while she was in hospital, she says, I don't want any treatment. And when she had something set in her mind, that was it, bang. You know, there was no telling her any different. I hugely admire her for that.
When my grandma was ill, my granddad would look after her quite a lot, and he would never go to bed without her. So he'd always sleep in the living room, because by this time my grandma didn't like lying down, so she liked sleeping in a chair, so he would sleep next to her in his chair. And my granddad actually didn't know that she died. He thought that she was just asleep, so he actually rang the doctors and he said, oh, I think my wife's dead, but I'm not too sure.
She died of a blood clot. Hugely distressing seeing your mother pass.
My dad hasn't been the same since his mum's passed away. She was just always happy to see us, and really miss her.
Andrew?
Andrew?
How are you doing? Andrew? Are you guys ready? Yeah, you happy? Andrew?
After grandmother passed away, my granddad went downhill. He's got vascular dementia.
He's in a residential care home. He constantly talks about Mum. He constantly says he misses her. He constantly says, I was quite looking forward to seeing Mum. Then I realised when I got to where I was that I wasn't going back to the home and Mum wasn't there. An innate sadness, and he's not the man he used to be.
Andrew, there you are. It's all done. You were a long way away, weren't you?
Well, yes, I was at the northern coast of Spain.
Well, that sounds lovely.
Which is a happy place.
That's a very happy place. That sounds really nice, to be honest, yeah.
There was an old people's home. Outside every door of the people's rooms, they had a picture of the person, the inhabitant of the room, when they were younger, and it gave a little summary of their life. And it makes you realise that the people who are behind that door that you're going to go into, who are nothing like what you remember them, it's hanging on to what they used to be rather than what they are now. And I think that's my way of dealing with it.
You still off the coast of Spain somewhere, are you? Sunbathing?
He always recites one poem, and it's about how life gets so crazy and so busy that a lot of people just don't have time anymore just to stop and just appreciate the clouds. And he's actually got it on his desk. Sometimes I wish I'd go over and just point at it and for him to just stop.
Nine-year-old Callum is in A&E after pushing a piece of plastic toy into his ear.
Are you laughing? Is he laughing? He's spinning around, he's going to fall over. Isn't he?
Me and his dad split actually when I was pregnant with Annie. The events that led up to that was that, I'm trying to cope with Callum, and also I'd taken sort of 18 months to fall pregnant with Annie, and that put a big pressure as well on our relationship. There was lots of emotional things going on, and I just don't think necessarily we were there for each other. It's hard, it's tough, but it's also quite rewarding knowing that you do it all by yourself. Somehow it's easier because it's just my rules.
So I'm just going to try and get this. This is Callum. We're just going to try and get this little bit of plastic out of his ear. Okay. If you wouldn't mind just pulling the ear slightly back, just so it straightens the ear canal. This one, sorry. So yeah, if you just grip the pinner there and then just put it slightly straighter. That's fab.
Good boy, Callum.
Fabulous, Callum. Okay.
Well done, mate.
Sorry, Callum. Sorry, Callum.
I'm going to try and get it. Try and get the thing out of your ear.
Yeah, it's really interesting.
Good boy. Good boy. Let me tickle your back. No, Mummy, hold on.
Nearly there, Callum. Oh, no, don't push it any further.
Good boy. We try and get it out. Good boy.
We're going to try and get it out, Callum.
Good boy.
Ow!
Good boy.
Got it.
Good boy. Look. That was
we go.
Ryder. You put Ryder in your ear.
There we go. It's a little bit of plastic.
Oh, I know, darling.
Oh, I'm sorry.
Lovely.
It might just be a little bit sore for a couple of days, but it should be all right.
Lovely.
Thank you very much.
Thank you. Cheers, Annie. Good boy.
As Annie grew older, I felt that she was missing out on time with me. A couple of times I've sat with her and talked things through, tried to get her to see how he's different to other children. It was difficult in the beginning. She didn't understand, of course, didn't understand why her brother wouldn't play and why her brother didn't talk to her. I have moments where I think I'm just not doing things as well as I should be, or things could be better than they could. And now she's a little bit older, she's amazing. For instance, he can't do a zip up on his coat, so she'd quite happily stand and I'll do it. I'm just grateful that I've got a child who I'm able to rely on, and my thoughts are sort of later on in life, she will be there for Callum. She's probably a little bit like my rock, actually.
Come here, Poppet. Did you get some, yeah? Good girl.
Snakes make very good pets.
Good boy.
My kids mean everything to me. I just want them to be happy and I want them to experience as much as possible. For Callum, that might be a little bit limited, but I still feel that I should push him to experience exactly what his sister experiences. I love them with all my heart. Yeah, of course I do. Yeah, they mean everything to me.
A bit more protective, and I always look at paving slabs now. And I just think, watch your step and stuff like that.
The sense of not knowing exactly what's going to happen, to think, well, will he pull through? Is he not going to pull through? It's so much goes through your mind.
I sent her flowers and a card on Mother's Day, thanking her for being such a good nurse and everything.
What does she mean to you?
It means the world to me. I love having a family around me and being, what's the word they use? Not the kingpin, but some of the grandchildren still regard me as that. That's a lovely feeling.
Ever seen the first Rambo film? You know, the one where he gets his leg sliced open, just unscrews the tip of his knife, gets out the needle. Savage. Imagine Rambo in A&E.
Hello, St George's.
The doorbell went, and it was the police. I just said to them, it's my husband, isn't it?
If you're a cyclist, whatever you hit, your body takes the direct impact.
How come he's just got so crushed? That's the question.
It was like it wasn't happening to me.